So I'm here today to talk about reducing the noise to engage consumers and referrers to Western Health Medical Imaging. We've got a big team here today with both Eleanor Garnes and Kelly Foran and our Chief Medical Officer. I'm not sure whether he's arrived yet for the panel, Paul Everthariou. And moving on. Wouldn't this be great if this was the start to our day where we didn't have all these competing demands in our organisation, that we could just turn up, hopefully see our patients, choose wisely whilst we're seeing them, but no. Noise, as I've defined it, is the constant things that we have bombarding both our clinicians and our consumers. So just quickly, the Western Health experience recently, we've implemented electronic medical record across our 4 sites last November. We've just moved in 2 weeks ago to our new Joan Kerner Women's and Children's wing. We're building a 1.5 billion Footscray hospital, so in the functional brief planning for that. We've just rolled out a sepsis project, and there's many more like the project. We're just doing the People Matters survey. So we do have this constant noise where our clinicians aren't necessarily, that's a bit blurry, doing what we need to with our patients every day. So with our Choosing Wisely project, we wanted to embed our long-term sustainability of our initiative. We integrated into our existing governance and quality structure. Our Best Care framework provides a robust structure to enable the future-proofing of implementation of innovations such as Choosing Wisely. As you can see from the graphic, there are 4 domains of best care that reflect our commitment to our core values. So we have coordinated care, safe care, person-centred care and right care. These 4 committees report to our overarching Best Care Committee that reports directly to our board. Sustainability of Choosing Wisely was a key performance indicator to the success of our project, therefore was embedded into our Right Care Committee very early on. Our governance for the project was overseen by a steering committee led by our Chief Medical Officer and was supported by a working group with consumer involvement. We're currently implementing a new committee that will feed into our Right Care Committee that's currently called the Low Value Care Committee, but we are changing the name, and we're hopefully got a competition about that because we are quite competitive with our which I'll share with you later on with our PR plan. This new Low Value Care Committee, and welcome for any suggestions on names, has membership from across all our divisions, specialties, craft groups, with their role to review and recommend future Choosing Wisely projects across the organisation. So initial things post our medical imaging, we'll be looking obviously at pathology and how we can build more into our electronic medical record to actually make this not a new thing, but that sustainable thing that people don't hopefully have to think about too much, but it is there to guide them in front of them. So hopefully we have got the right governance that will ensure our longevity of Choosing Wisely. I too was going to give someone a keep cup, and he's not paying attention at all. I thought, oh, that would be a funny thing, not realising, well, yeah, it's a common thing. So it's stashed away in my handbag. So if anyone does want a Western Health Choosing Wisely keep cup that's modelled here by our executive, please come and ask me a question at lunchtime and it's all yours, but I do feel bad if you've already got one, so please don't take it. So obviously our poor executive, yeah, we roll them out, but it is really important to have obviously top-down support and bottom-up support for any initiative that we are trying to make a movement to continue that sustainability going forward. So what did we do? Our big thing was engaging our public relations team. And this has been one of the best things that we actually did from right at the beginning. We developed a comprehensive communication plan, and this comms plan was the key to our success in both implementing Choosing Wisely as well as ensuring its sustainability. This plan allows us to use the same principles regardless of whatever the project's going to be across the organisation. So to engage with the staff and our volunteers and consumers, we built sayings around obviously our 4 domains. And the main one is probably for right care, just to give you that example, from the patient's point of view, I receive care that makes me feel better. From the clinician's point of view, the medical imaging that I order is appropriate for the clinical condition of my patient. And in this practice, this looks like more is not always better. All test treatments and procedures are justified and necessary for the patient. Our comms plan also helped form our timelines for the project, and it also then helped us develop, identify our potential barriers and risks and development of our risk mitigation strategy and our evaluation plan. One of the things that we did look at are key messages. And we like our food at Western Health, or particularly the project officer, Eleanor and I. And Eleanor started taking some great pictures of some food. So it's really important to develop your key messages. And our two messages are, more is not always better, ask why and justify. And I'm sure that could be a little rap song as well if we worked a bit harder on that. We established context for the purpose of education and stakeholder engagement before moving into a detailed narrative utilising background, current situation and aims. One of the big things we did, instead of sending out a lot of emails to our medical units and surgical units, was that we actually asked to meet with the heads of unit, and we went along with our Director of Medical Imaging and sometimes our Manager of Innovation and Improvement, as well as Eleanor, our Project Officer, and we gave them an individualised pitch that came out of this comms plan. So we gave them data that was relevant to the tests that we were asking them to look at and change their referral for those tests. We then provided a target education plan, and these were presented to the units that were involved in this rollout of Choosing Wisely. And these were presented by our medical imaging registrar, Eleanor, and then a unit champion as well from that unit to try and get that engagement on the floor. The other thing is we did a competition. So yes, there's Keep Cups if you do win one. We've got the Choosies Awards, which are nominated and awarded in our newsletter. And then we had a poster competition. So there's a dim sim floating in too much soy sauce, a bit too much jam donut, and too much Vegemite on your toast. So these are all getting rolled out, and they do have a great effect, but it is one of those things that you just don't want too many posters around on the back of toilet doors like we all tend to do. So to finish up, our take-home messages are you really need to integrate any of these projects for that sustainability into your existing governance structure. And that's been the biggest thing that we've done, and we did that from very, very early on, and it is at this stage going well. Engage a public relations department if you have one. Our comms plan, it's a very extensive document and more than happy to share, really helped us define the problem and sell this initiative to see the gains that you can make from it. Utilise IT, such as your electronic medical record and things like that. You can build a lot of things into this, and I know it's quite hard, and there often is funding implications with it, but there are things to do with an electronic medical record if you are lucky enough to have one. And from Trish's talk this morning is attend to human relationships. Biggest thing was the team that we developed, our unit champions, and we bred from ground level up to exec. So we're lucky enough to have a chief medical officer who's very into Choosing Wisely. But yeah, it's breeding your champions to make your project sustainable and embedded into your workplace culture. Thank you.